Hi, I'm Johnny Stokes. I'm based in the Multimorbidity theme of the Patient Safety Centre. So, multimorbidity is the presence of two or more long-term conditions in a single patient. So, long-term conditions can be things like asthma, diabetes, all these sorts of conditions, and you can get obviously lots of them occurring in a single patient at once, and it makes it more difficult to manage each of them individually. So that's the main patient group of that my PhD is focused on. In terms of the intervention, it's around integrated care, which is the attempts of the health services to better join up care for these patients, better coordinate, and hopefully reduce the risk of harms from lack of coordination. I'm sure you've seen headlines in newspapers about A&E cracking at the seams, which means that there's lots of pressure on our health services, obviously. This generally accepted is caused by an aging population, so an increasing proportion of people who are elderly, who are more likely to be multimorbid, have an increased number of conditions. There's also the fact that there's not much known about the topic, which makes it interesting because there's lots of different ways you can approach it, which makes it really interesting. The idea of integrating care has been around in one form or another for a long time now, but it's only recently especially with the global economic crisis and the cost pressures this has put on health services and every other kind of public service, that it's become a real pressing issue for policymakers to tackle. For that reason, they've put a mandate for commissioners to commission services which integrate care, which is a very vague concept at the moment and makes it extremely hard for commissioners to implement. So by generating some evidence of what works or what doesn't work, hopefully this will help commissioners commission the appropriate services for the future. So in terms of the work, I'm hoping to generate some new knowledge, advance the field a bit. Personally, I'm interested in the challenge of the PhD in general, and I'm learning new skills by doing it, developing them, and learning about things that really interest me, the topic area.